Ginger is a spice that has been used for centuries in various cuisines and traditional medicines. It is known for its pungent flavor and aroma, as well as its anti-inflammatory, antioxidant, and anti-nausea properties. But what happens to your body when you eat ginger every day? How does it affect your digestion, immunity, blood pressure, and more? In this video, we will explore the scientific evidence behind the health effects of ginger and provide some tips on how to incorporate it into your diet. So let's get started. How ginger works in your body. Ginger is a rhizome or a stem that grows underground of the plant Zingiber officinale. It contains several active compounds such as gingerols, shogols, pyridols, and zingerone that are responsible for its medicinal and culinary properties. These compounds interact with various receptors and enzymes in your body, modulating different biological processes and pathways. Some of the main effects of ginger on your body are: it stimulates the production of saliva and gastric juices, which helps with digestion and appetite. It relaxes the smooth muscles of the gastrointestinal tract, which reduces cramping, bloating, and constipation. It inhibits the growth of Helicobacter pylori, a bacteria that causes stomach ulcers and gastritis. It blocks the synthesis of prostaglandins, which are inflammatory molecules that cause pain and fever. It activates the thermogenesis or heat production in your body, which boosts your metabolism and burns calories. It inhibits the aggregation of platelets, which prevents blood clots and lowers the risk of stroke and heart attack. It modulates the immune system, enhancing the activity of natural killer cells, macrophages, and T cells, which fight against infections and tumors. It regulates the blood sugar levels by increasing the insulin sensitivity and glucose uptake in the muscles and liver. It protects the brain from oxidative stress and inflammation, which may prevent or delay the onset of neurodegenerative diseases, such as Alzheimer's and Parkinson's. As you can see, ginger has a wide range of effects on your body and can potentially improve your health and well-being. However, it is important to note that not all of these effects are equally supported by scientific research, and some of them may vary depending on the dose, form, and duration of ginger consumption. Assuming that you consume ginger in moderate amounts, and that you do not have any contraindications, eating ginger every day can offer you several benefits, such as reducing nausea and vomiting. Ginger is one of the most effective natural remedies for nausea and vomiting, especially during pregnancy, chemotherapy, or motion sickness. Several studies have shown that ginger can reduce the severity and frequency of nausea and vomiting, and that it is as effective as some antiemetic drugs without causing any significant side effects. Relieving pain and inflammation. Ginger has been used for centuries to treat various types of pain and inflammation, such as arthritis, menstrual cramps, headaches, and muscle soreness. Several studies have confirmed that ginger can reduce pain and inflammation by inhibiting the production of prostaglandins and other inflammatory mediators. Ginger can also enhance the analgesic effect of some drugs, such as ibuprofen and acetaminophen. Before we continue, if you're enjoying this video, don't forget to hit that like button and subscribe to the channel. It really helps us and let us know what kind of content you want to see more of. Improving cardiovascular health. Ginger can lower the risk of cardiovascular diseases such as hypertension, atherosclerosis, and coronary artery disease by improving the blood circulation, preventing the formation of blood clots, and lowering the cholesterol and triglyceride levels. Several studies have shown that ginger can reduce the blood pressure, the arterial stiffness, and the oxidative stress in the blood vessels, and that it can increase the HDL, or good cholesterol. Boosting the immune system. Ginger can strengthen your immune system by stimulating the production and activity of various immune cells, such as natural killer cells, macrophages, and T cells, that can fight against infections and tumors. Several studies have shown that ginger can enhance the immune response to vaccines and that it can protect against respiratory infections, such as colds and flu. Enhancing the cognitive function. Ginger can improve your brain function by protecting the neurons from oxidative stress and inflammation, and by increasing the blood flow and oxygen delivery to the brain. Several studies have shown that ginger can improve the memory, attention, and reaction time, and that it can prevent or delay the cognitive decline associated with aging and neurodegenerative diseases. These are some of the most well-known and well-studied benefits of eating ginger every day, but there are many more that are still being investigated, such as Preventing or treating cancer. Ginger has been shown to have anti-cancer properties by inducing apoptosis or cell death and inhibiting angiogenesis or blood vessel formation in various types of cancer cells such as ovarian, breast, prostate, colon, and skin cancer. However, more human trials are needed to confirm the efficacy and safety of ginger as a cancer treatment. Preventing or treating diabetes. Ginger has been shown to have anti-diabetic properties by increasing the insulin sensitivity and glucose uptake in the muscles and liver, and by lowering the blood sugar and hemoglobin A1C levels. However, more human trials are needed to determine the optimal dose and form of ginger for diabetes management. Preventing or treating obesity. Ginger has been shown to have anti-obesity properties by activating the thermogenesis or heat production in the body and by suppressing the appetite and increasing the satiety. However, more human trials are needed to evaluate the long-term effects and safety of ginger for weight loss. The risks of eating ginger every day. While ginger is generally considered safe and well tolerated, eating ginger every day may also pose some risks, such as causing allergic reactions. Some people may be allergic to ginger and experience symptoms such as itching, swelling, rash, hives, or difficulty breathing. If you have a history of food allergies or if you notice any of these symptoms after eating ginger, you should stop consuming it and seek medical attention. Causing gastrointestinal discomfort. Some people may experience gastrointestinal discomfort, such as heartburn, acid reflux, diarrhea, or stomach pain, after eating ginger, especially in large amounts or on an empty stomach. If you have a sensitive stomach or if you suffer from any gastrointestinal disorders, such as ulcers, gastritis, or irritable bowel syndrome, you should limit your intake of ginger or avoid it altogether. Interfering with blood clotting. Ginger can inhibit the aggregation of platelets, which can prevent blood clots and lower the risk of stroke and heart attack. However, this can also increase the risk of bleeding, especially if you have a bleeding disorder or if you are taking any blood-thinning medications, such as warfarin, aspirin, or clopidogrel. If you have any of these conditions or if you are scheduled for surgery, you should consult your doctor before eating ginger or stop consuming it at least 2 weeks before the procedure. Interacting with other drugs. Ginger can interact with some drugs and either enhance or reduce their effects. Some of the drugs that may interact with ginger are anti-diabetic drugs, such as metformin, insulin, or sulfonylureas, antihypertensive drugs, such as beta blockers, calcium channel blockers, or angiotensin-converting enzyme inhibitors, anti-inflammatory drugs, such as ibuprofen, naproxen, or corticosteroids, and antiemetic drugs, such as ondansetron, domperidone, or metoclopramide. If you are taking any of these drugs or any other prescription or over-the-counter drugs, you should check with your doctor or pharmacist before eating ginger or adjust your dosage accordingly. Affecting the hormone levels. Ginger can affect the hormone levels in your body, especially the sex hormones such as estrogen and testosterone. This can have positive or negative effects, depending on your gender, age, and health status. If you have any hormonal issues or if you are pregnant, breastfeeding, or trying to conceive, you should consult your doctor before eating ginger or avoid it altogether. The recommended daily intake of ginger varies depending on the source, form, and purpose of consumption, but a general guideline is to consume no more than 4 grams of ginger per day, or 1 gram per day for pregnant women. You can divide this amount into smaller doses throughout the day, or take it all at once, depending on your preference and tolerance. You can also adjust the amount according to your body weight, age, and health status, or consult your doctor for a personalized recommendation. Share your favorite recipes with ginger in the comments below. Thanks for watching.